The cough is a natural reaction to irritation or inflammation in the throat or the airways. COVID-19 starts by infecting tissues in the throat, and then it will move down into the lower airways and into the rest of the lungs. This means that cough is one of the most common symptoms of patients with COVID-19. In some studies, about 80% of patients present with a cough. Most patients have a dry cough, which means that it's just really irritation in the throat and then those large airways. But sometimes when it moves down into the deeper airways and into the small air sacs, known as the alveoli, patients can start to develop a wet cough. And this is when they develop sputum or mucus production. When those airways get irritated, they create mucus and then patients will cough it up. This in and of itself is not necessarily a reason to be concerned. However, it can be associated with some significant shortness of breath. Now, if you start to have severe shortness of breath, which I would define as difficulty walking to the bathroom, doing your normal activities of daily living, that would be a reason to seek medical care. Also, occasionally, patients can cough up little bits of blood. Small specks of blood are not uncommon and they're not necessarily dangerous. That can just happen because of irritation from repeated coughing. But if you start to cough up frank blood, that would also be a reason to go right to the emergency department. The duration of this cough, it's hard to say. It varies from patient to patient. It's usually several days, but some patients report having a couple of weeks of the ongoing cough.